So eating disorders encompass a range of behaviors, from restrictive eating, really limiting the amount of nutrition that a person is consuming, behaviors like binge eating, like losing control over eating, having a hard time stopping, engaging in compensatory behaviors like engaging in vomiting behaviors or using laxatives or diet pills, and over-exercising behaviors. We also see, a range of thinking in eating disorders about being scared of food, having particular fear foods, and having intense fears of gaining weight. Even in the context of real malnutrition and real medical illness, that fear persists and can be a real challenge in keeping someone physically and psychologically safe.
It appears that eating disorders are becoming more and more common, more prevalent. We are learning more about them. There's more awareness, so people are paying more attention to that, and we've been seeing that the children especially, are being recognized as having disordered eating earlier in their life. We are a tertiary care facility, so by the time the child comes to us, they are fairly impaired in terms of their overall health.
There's lots of different factors that contribute to the development of eating disorders. It can be anything from biological vulnerability and genetic vulnerability to illness, to environmental factors, social and cultural factors. But we typically see eating disorders develop in adolescence or even early adulthood. And, they're very dangerous illnesses. They can affect every body system, from the heart system, the cardiac system, the GI system. All different kinds of physical ailments can come from being malnourished. And so people come to the hospital, to an inpatient facility like ours, when there are real risks with their eating disorder, that they could be medically compromised and they need comprehensive, structured care.
So primarily we're seeing individuals with anorexia, bulimia, and ARFID. And I think overall we individualize our treatment for all patients who walk through our doors. So we are meeting them where they're at, and depending on what has been going on prior to admission, their diagnoses, we're going to outline the best treatment plan that is going to help them.
So we take a collaborative, team-based approach. Our team is comprised of folks in different disciplines. So we have our medical team that's built with psychiatrists with specialty in eating disorders. We have a therapy team with social workers who have expertise in eating disorders and varied treatments, and expert nutritionists who are specialized in the treatment of eating disorders. And together as a team, we sort of come up with a comprehensive approach to each patient's presentation.
First, we educate patients and their families as well. The approach that we take is an all foods fit philosophy. So we're really helping them challenge foods and not label them in certain ways as good foods or bad foods or unhealthy or healthy, and really having a neutral status with foods and be able to meet their nutrition needs here in program as well as after discharge too.
I think for people with severe and chronic forms of eating disorders, it can be easy to feel hopeless, right? They've had multiple treatment experiences that have not led to sustained remission in their eating disorder symptoms, and lives can feel smaller with an eating disorder.
Many of our patients on admission identified that they felt hopeless or stuck in their eating disorder, hopeless about recovering from their eating disorder. And as nurses, we identified this as an area that we could help patients build their hope while here.
And so the Pathway to Hope is a project that our nursing team developed. Really, it's based in something called hope theory, which is the idea that in making changes in life, having hope sit alongside you as something that really makes it more possible to achieve an alternative path.
So one of my favorite things about working here at Penn Medicine is being able to see our patients excel in their treatment and find out what their strengths and weaknesses are in order to help them progress in their journey to recovery. So being able to see our patients come in on admission with a very concrete thought process and discharge with the possibility of hope is a great thing.
I see our program building a research presence. We're really working on innovating and understanding treatment for eating disorders in new ways, and I see that continuing into the future. We're also building our capacity to train specialized eating disorder clinicians. It's really uncommon for folks to have access to specialized training in eating disorder care. And so by training social work students and nutrition students, nursing students, physician students, psychology students, we're really contributing to increasing the access to specialized eating disorder care in future generations.